You're listening to the Men's Health Foundation podcast. I'm David Watson.
And I'm Marc Esposo.
Men's Health Foundation is a nonprofit healthcare provider for all men, specializing in gay men's health here in Los Angeles.
Each episode, we welcome members of our care team to discuss trending topics in medicine and wellness to help you take charge of your health.
Welcome back to the Men's Health Foundation podcast. This morning, we're joined by André-Jamison Molette, the director of SoCal Club here at Men's Health Foundation. Dre, thank you so much for being on the show.
Thank you. Definitely, I'm excited to have this conversation today.
So are we. Yeah. Thank you. A little background on Dre. Dre, I know you've been working in public health for maybe more than a decade now?
Yeah, it's been a decade.
And previously with ALPHA, Health and Wellness, the LA LGBT Center, and Essential Access Health, doing STD prevention and navigation. And I know that also you've worked helping folks get on PrEP and PEP in South LA. And of course, in South LA, that's where we have SoCal Club. How would you describe SoCal Club to someone who hasn't heard of it before?
Yeah, for me, SoCal Club is, like we like to say down there, it's a place where young queer men of color want to be. We really want to emphasize it that it's a healthcare facility, really making sure that people get tested for HIV and STI, making sure they're having active conversations about sexual health, but also a safe space for young folks to come and really talk about conversations that they are not able to have in school, with the Children and Healthy Youth Act with CHIA. Sexual health education is supposed to be talked about in high schools, but unfortunately with the lack of health educators or even people who can talk about it in high schools, there hasn't been a robust conversation about it. Speaking to folks at Compton Unified or Inglewood Unified, when we talk about folks fulfilling their A through G requirements, some of the times they don't get fulfilled to graduate because they don't have that sexual health conversation or that health conversation. So now SoCal Club kind of takes that place, and we have groups where we can talk about sexual health. We have groups where we can talk about life skills like resume building. We have conversations, barbershop talk, where we're a lot of our folks are going to the barbers to get their hair cut, and they just don't feel comfortable they're having that I wouldn't the kind of heteropatriarchy conversation about socializing as a man but not socializing as a gay man. So we really want to have those kind of conversations where they can feel comfortable, get a little touch up, maybe make a connection with a barber, and then they're able to feel free and socialize with other people. And then we have our health and wellness activities, which what I like to do is I like to compare, folks are coming to the space to get information about health, but also what about wellness. So we'll do a conversation called the D about love, sex, and relationships, where they can talk about safer sex and also healthy ways to meet and socialize people. But then after that, they're able to do wellness. So currently we offer yoga, Zumba, kickboxing, where we actually partner with the local boxing gym next door. And then we also do pole dancing, which is a major hit right now with our partners, Romance and Dance and Carson. And they actually do sexual health conversations for women. So we're really trying to be a partner with them and have our health educators talk to women in the community about ways that they can protect themselves as well. But then that all wraps around our clinical services as well, where we want folks to come back once every 3 months to actually get a sexual health checkup. So we do wellness checks led by our SoCal Club navigators. And those wellness checks are just talking about things around the social determinants of health. Do you have access to healthcare? Hopefully you do, because you're coming to Men's Health Foundation. And then we're talking about social things. How are you socializing with people? What does that look like? And then we're also talking about housing. Housing is a big problem, not just in South LA, but everywhere in California. So we offer kind of our THEP program. And that THEP program is really a program to help bridge people to get into housing temporarily, so they can, get into permanent housing. So we partner with a couple of community partners that are in the area, Ahmad, Arming Minorities Against Disease and Drug Abuse. And then we have God's Property, which is a sober living space founded by a person living with HIV. And then we have Mama's House, which is Mama's House based in South Los Angeles in Riverside County, where they do supportive transitional housing as well. So.
Wow, so many services.
I know.
Wow.
Yeah. I haven't even talked about food bank yet, but yeah. So we just opened the food bank there as well. So yeah.
Yeah, I can only imagine the difference that can make for someone.
Yeah, definitely. So we see, my expectation is when a person comes into the space, they're spending about 3 to 4 hours at the club, not just having a conversation. They're sitting chilling with friends, and they're like, hey, maybe I need to go over to the clinic and get tested. And so they're moving over to the clinical space, and they're talking with our providers, getting tested. And then we're also talking about, hey, have you brought a friend? So asking them to bring friends to come in to know about their status. And then they're coming back over and doing our supportive programs.
Wow. How do most folks find out about SoCal Club who come through?
Instagram. Instagram is like our biggest way of actually engaging folks. Well, also we have a robust outreach team, which is on the apps, Scruff, Growler, Sniffies, and they're actually having conversations with folks. So they'll go out to a park, and then they'll sit there in the neighborhood and they'll start chatting with people, letting people be aware of our services. And we do see a lot of foot traffic. We're also posting like our little stickers in the areas saying, are you curious? And they scan that QR link and it links them back to the clinic. And then we have a specific flyer that we use when we're going out, just to encourage people to come and get tested. And we'll see those flyers come back. So we know, oh, you're coming from Park Outreach, or you're hearing from us through our geosocial networking, which is called GSN. So.
Yeah. I'm curious when it comes to the idea of a safe space for, queer youth, and especially in the community that you're serving. I would imagine that part of the challenge would be if they're in a home environment that isn't supportive of, who they are, or maybe them even seeking out these kind of services from an organization like this. How do you navigate that, and how do you help create this safe space and keep it safe for folks?
Yeah, definitely. We have a couple of ways that I've learned how to make sure that we're still enabling a safe space. I like to use youth-adult partnership framework. So really making sure that when people are coming into space, it's not like you're here at the club, these are the rules, that people receive a handbook, but it's also talking about using making sure that whatever they want, that they're invested. So we have our community advisory board, and that's a board made of 11 young folks, and they're really talking about things they want to see in the community. So it's from like having activities from skate night, which they enjoy, or like having like a Valentine's Day activity, or like, a lot of our folks attend church with their family members still, but they feel like, some of the celebrations, like Easter, don't feel family friendly. So we have kind of like a community Easter brunch, so they can feel comfortable with, the day before going to church with their family. They can actually have some kind of community before entering into that space.
I was wondering about the staff that you have there. In creating this safe space, do you look for like certain types of staff? Like how do you go about like staffing the club to make it a safe space?
Yeah, in conjunction with for people operations team, I really try to standardize a policy that we have here at Men's Health Foundation. One thing that I do like during the interview process is I do like activities. So I will during the hiring process, I do talk about like, can you do just a quick 2 to 3 minute presentation about ending the HIV epidemic, or talking about like services in South LA. So like during the interview, and then my team, we at least the person, if they're a health educator, then the health educator is interviewing them as well. So we do have kind of a small group interview process. We're looking at presentation, but also how people can facilitate. We also want to understand that while working for Men's Health Foundation and also at SoCal Club, we wear many hats. So you may be the health educator today, but you're also going to be doing outreach as well in the community. or working with community partners. I think it's really important that South LA is very strong, committed to making sure that other organizations work together. One of the strongest organizations in South LA, Community Coalition of South Los Angeles, which is actually founded by Mayor Karen Bass, is really invested in making sure that empowering youth specifically. They have a Summer Nights Lights program, which we've participated in, community health fairs. And then also, what's your engagement? How do you feel about talking to young people? That's really important. So I want to just make sure that anybody who comes to SoCal Club knows that, we're not just dealing with just young people, but young people who, maybe college graduates from USC working at JPL, to someone who is just a freshman in high school learning about their identity. So we have different spectrums. So we try to make sure that if you're going to work for us, you're going to have to deal with a broad range of folks.
Yeah.
Yeah.
Awesome. That's cool. Yeah. So you briefly mentioned the range of people that you cater to. So for people who might not know anything about the club, what are the ages that you guys...
Always great to say that. So we do 12 to 29 young gay men, trans and non-binary folks. So we're funded by the county, Los Angeles Department of HIV, STI Prevention, DHSP. So we've been a part of this grant for about 5 years. What we're noticing in our classes is that we're lacking a lot of health education. Like the basic, people don't understand or still don't know what the methods of HIV transmission are. So we're still having engaging those people with those conversations. So yeah.
I'm so curious with the experience you've had working with young people, and of course, as they're born later and later. How has that changed the types of questions that you get asked, or the sort of level of awareness? I'd be curious to hear with younger generations that you're working with, what you see as far as what's changing, or maybe what's staying the same.
I would say this interactions with folks. I would say, everyone is on their phone.
Yeah.
24/7, back in the day, because, I'm an empowerment kid. So I actually started in the empowerment program 20 years ago in Salt Lake City, Utah, where I'm from. Okay. So back in the day, those conversations were like, oh, how do you meet people? You meet them at the bar, or you go to the park or a library. Now it's all like, how do you meet people? On an app. Or maybe, there's like a meetup group, or there's an Eventbrite, or there's a concert, or I found something and there's an event. So interactions have changed a lot. And I feel like, especially with social media, the emotion has been taken out of conversations. People aren't able to see, unless you're putting an emoji in a chat, people don't know how you're feeling. So there's definitely things have been misinterpreted. Folks come up to me all the time. They're like, Dre, I'm talking to somebody and I'm feeling them. But they're just not reacting. I'm like, well, did you call and pick up the phone?
Right.
They're like, no, I'm texting. I'm like, that's the issue. You're continually texting. You're not having that kind of conversation with them. You're just, the phone.
Yeah,
I can totally relate to that. Just think, you're missing context clues when it's just purely text.
Yeah.
I was wondering about if you could share any stories about members who you've seen really grow from where they were, and then how they where they ended up in life, their personal life, their mental health, everything. Yeah,
I would say it's only been year 2, so I can say I've seen good growth, but I don't know if I can really measure it yet. I want to say within 5 years I can get a broad measurement of what it looks like to be a successful person at the club. We talk about in our staff meetings all the time. It's what does it look like for a club member to be successful at SoCal Club? But I would say there's 2 people that come into mind. The first one, they came through our high school program, our Popular Peer Leaders program. They had already been invested in the community through activities like Spring Into Love. So they knew about health education already, and they knew how to empower our communities. They came through, and they're like, I really want to be a part of this. This is a space that represents me. They're a high school senior currently.
Okay.
So we help them with their applications to go to schools, for university. They've really supported our high school program. They'll usually bring about 5 or 6 folks to come through our programs. They're saying like, hey, did you hear about an event that happened? And I'm like, no. What event is this? And they're like, well, I'm going to it. And I'm like, okay, so we're going to go to it with you as well. So supporting them. I'm just currently finding out that they got a full-ride scholarship to University of Northern California.
Amazing.
They're being courted. They're being flown out to go to the school. We're also, okay, that's great, but what about the other schools? Did you give did you apply to any of the local UCs? And they're like, yeah, so we're waiting on those. So hopefully this person can stay local. I would love to see them be a part of the club a little bit more. But if they have to go, they have to go. I mean, when you're getting a full ride to our NorCal University, you just gotta go. So
wow, that's amazing.
So that's successful. And then I would say another one, they were a part of our cab. They've been coming for a while. They have been in Los Angeles for about 3 years, but they seem to really enjoy work, just volunteering. And so some positions actually came up at the Men's Health Foundation, and they actually applied and they became the prep navigator. So and I'm always encouraging our young folks to if you like the field, come work for us. But they also know that Andre I like to work them a little bit more. I like to make sure that my staff is on their toes and challenged. So they're like, the word is, I just found this yesterday when I was at a conference. They're like, you work for Dre, you're going to work. So they're the prep navigator, and then they transitioned to a role. They're now working underneath me directly as our outreach specialist. So
amazing.
Yeah, I think one thing that's so interesting when you were talking earlier about, such a digital focus on how people socialize, it's so interesting that SoCal Club is this in-person experience that, also can be really physical a lot of times. And I wanted to bring that up because one of the things that I often think about, I think some of the events that get a lot of attention at SoCal Club are the events involving the ballroom community. And I'd love to just ask about your relationship with that, with SoCal Club, and kind of the impact that has on the club.
Yeah, definitely. The balls have been the highlight of the club. It's taken a while to get them into the space. I do, I like to work with our existing community partners that actually do the work. So, Reach LA, a very strong partner in the house and ball community. So I didn't want to take away from that, but also really invest into what folks in South LA are doing. And so we kind of had a rule that said, if you're in a house, in a Kiki house, so there's mainstream ball room, which is the whole prompt and circumstance of you're going to be there for 6 hours. They're going to do the march. All the houses are going to come out. They're going to have the conversations. And they're going to do the full ball. All the videos that you see, that's a full ball. They're giving out thousands of dollars of prizes. There are at least 10 to 15 categories at a ball. A Kiki ball is shortened. So we're only having about 4 to 5 categories. And then they're Kiki houses. So, the main house and ball, you have the house of Marc Jacobs. So you have a lot of those houses. And with the Kiki ball scene, they're kind of, they're not they're the house of, I don't know if I can say this, House of Coochie. They're the house
That's
of...
fine.
Yeah. I don't know if I can cuss. So the House of Coochie, the House of Juicy, Couture. So those are the ones that we work with. And they're they're smaller. They have maybe about 10 members. Mainstream houses have about 20 to 25 members. You're paying dues as well to the main houses to keep them running. They're really small. So we said that, hey, we're going to have time for the Kiki houses to practice at the club. So when they have time to practice at the club, and then we have our Vogue classes, then that helps complement each other. And, we have one of our cab members, Rome, has been very integral about doing Vogue with his Kiki house and also his mainstream house as well. So he has really brought that foundation. And then we have the Kiki balls. So we have the Kiki houses in the community come. We're maxing out the space. So we're having about 100 people come in and all different ages. And they're doing their house. They're doing their ball. And what's really nice is just not having just the commentators who are local, or people have seen them like on HBO Legendary.
Yeah.
We're having our community really come out and show support. So our next Kiki Ball we're going to be doing is during Juneteenth weekend. We're partnering with Center South. And we're probably going to do like a full day event. So we're going to do not just the Kiki Ball is like the main event where we're doing prizes, but we also do a talent portion where folks have any other talents, they're able to come and show those as well.
Wow, amazing. I'm like, I wish I could join,
Well, come on, yeah. We always invite. Everyone is always able, and that's the most important thing. Like, if you want to come down to SoCal Club, especially as a staff member of MHF, you're more than welcome to help come, see the space, see what's going on. We always ask for volunteers, so definitely.
Yeah, what are your most like popular programs at the moment?
Pole dancing.
Pole dancing?
The kids love pole dancing. We're usually about getting 10 to 15 people for pole dancing. And I'm all like, okay, only 10. We can only do 10. So we have our pole dancing. And then our life skills classes have really been picking up. Our health educator, Jordan, has been really doing a great job of like listening to our community advisory board and really responding. And so he's been doing like, facilitation skills, how to facilitate. He's been doing classes about like, Outlook Word, like the Microsoft Suite. Because a lot of people have questions about that. And now with the addition of the Boric think tank, we have Chromebooks. So, it's not just looking on the screen and seeing what's going on. Everyone has the Chromebooks out. They're looking, they're figuring out how to do things. And then, and I also tell Jordan, it's like, you gotta present their work. So they're working on activity, and so everyone's presenting their activity. Another one that we were doing was our sip and paint. So we were doing that, talking about sexual health and painting, and that was also a hit as well.
Amazing.
Yeah.
I mean, I know I say amazing just because, like, I didn't have anything like that, like growing up, like a place. There probably was, but I didn't know about it, So it's good that, like, you don't offer just, like, one type of program. There's like a variety of programs, and also while you're doing it, you're like learning about sexual health too. So it's like, I'm just amazed.
Yeah, well, a lot of you have to. There's a lot of ways that people learn things. So you have to adapt to, people's auditory learning. Are they people that have to write things down? Are there people that have to hear? So it's making sure that we're able to engage people where they're at. And then also one thing that's been really integral to the club is like partnering with Life Signs to do ASL interpretation, because we do have folks who use sign language. So we want to make sure that we're able to bring those people in. So normally before someone comes to an activity, we use Eventbrite to see, and we ask that in the box about ASL interpretation. And so we'll say, oh, so-and-so's coming. Yeah. So we need to have at least 2 interpreters to come through. We're trying to figure out a way for Spanish language as well, because we do have a lot of monolingual Spanish speakers down there as well. We do our intervention called Sin Buscar Excusas, which is led by Amir. And so we want to make sure that we're talking about that as well and having those conversations too.
Yeah. One thing I wanted to make sure to emphasize to folks who haven't been to SoCal Club is just the space itself. I feel like is something to talk about. I think that's impressive, and I think that maybe in my mind, I think it sets it apart from some other community centers just because of what that offers. So, could you try to describe that for folks who are listening?
Yeah. Well, I was when you walk into the space, you're greeted by our patient access specialist, Kevin. Kevin is really going to kind of navigate you through SoCal Club. They'll welcome you in, give you a tour of the space. So you're walking in to the lounge. That's where folks are able to play video games, listen to music. People will be on YouTube, playing music as well. What's hot? Everyone's talking about the new Beyonce album coming out. Is it going to be country or not? So we'll usually put a question on the board, and we'll have the kids come in and answer it through the day. And then as we move into the space, we have our kitchen area. So folks need a snack or something, they're able to take a snack. And then we have our fridges where drinks are at. And then if you're looking down through the space, then you're having the Borg think tank where folks, some folks are coming in to do homework, or they just need a relaxing space just to chill before going into groups. So they'll be in that space. And then if you're going back into the kitchen and turning around, you have this huge dance floor, this huge floor space. Sometimes it's open, sometimes it's closed, and that's where we kind of have a lot of our group discussions. We're having our wellness classes there. And we're just also in our dance and vogue classes there. So you never know what day you're coming in, if you're coming into a community conversation, or if you're coming to yoga where it's going to be super quiet, or you're coming into Zumba where it's going to be loud and people are going to be really interactive. Or we have our wellness classes where everyone's kind of in a circle talking about where to meet guys at. So we have that. And then you turn into our RuPaul room area and our locker room. Our building used to be a bank. And so we still have this huge safe in the middle of the building. And so a lot of folks will go in there, put their items for the day. Sometimes I've seen young folks just chill there as well. They're all it's a nice space, it's quiet, and it has Wi-Fi. So they'll be in there with their computers just clacking away, just chilling. And then what's very nice is we're one of the first buildings in the area to have gender neutral restrooms. And I know Dr. Mills is took a lot of effort to get that in there. So we have our gender neutral restrooms, and then we have showers. So if people, because we do deal with the in-house population as well, so some folks are hey, I need to take a shower. I'm I don't want to go to a group or hang out with folks until I've been able to take care of myself. Mm-hmm. So definitely we have the showers available for them as well. And then that's kind of the space. We have that, and then they'll be able to come back and hang out in the lounge area. You go upstairs is restricted to staff, so we have the staff area that kind of looks over the whole space, which is kind of cool. So we're able to see we have these huge windows, and these windows bring in a lot of light during the daytime. Mm-hmm. So the clients like it before because a lot of our folks have seen it before the construction where it was really dark. And so we have these huge windows, this huge floating plant thing that's been designed, and so that brings in with the light. And then down the hallway we have the door, and the door leads to the clinic, and it's only one way, so our young folks can go through it, but other folks can't go in through it unless they get badged through security. So which is nice. So the youth always have access to go out and go to the clinic. They're I need to talk to my provider today. I have a question. Okay, we'll see if there's an appointment available, or Kevin will book the appointment for them and walk them over. So yeah, that's pretty much the space.
Cool. Yeah. Well, anyone out there, come through if you want to see it.
Yeah.
Yeah.
Well, what do you think is what's next for SoCal Club? What are you looking forward to in the future?
Ooh, that's a good question. I am always listening to the voice of our young people, so I lead with that 100%. So whatever they are asking, we try to meet that goal. Mm-hmm. We have a robust program. So just right now, trying to making sure that we have all the things in place before we move forward. So integrating wellness checks for all of our members is something that we're looking forward to do. And that's really it. Yeah.
All right.
Well, I'm looking forward to all of that. So, congratulations so far on an amazing program and an amazing space.
Yeah, congratulations, and thank you for everything that you're doing, Dre.
Yeah.
I think it's really, the space seems to always be, one-upping itself and getting better and better, and so much credit to you. So thank you also for joining us here. Great introduction to SoCal Club and to our SoCal Club director, André-Jamison Molette. Thank you so much for joining.
Thank you.
Thank you.